Then I was explaining about clinical chemistry panel. It refers to the biochemical analysis of body fluids. It uses chemical reactions to determine the levels of various chemical compounds in uh, bodily fluids, including serum, plasma, and sometimes urine and spinal fluid. Uh, and what is the difference between serum and plasma? I know you have learned this in your advanced level biology.
After the extraction of serum, we can get plasma.
Plasma. Okay, it is true for some extent. Serum is the centrifugation of coagulated blood. It does not include blood cells and protein factors, but it contains electrolytes, antigens, and sometimes microbes. On the other hand, plasma is the centrifugation of uncoagulated blood. So your answer is partially true. So we can take plasma by removing the serum part. In the plasma, it contains blood cells and protein factors. And we use this serum plasma like bodily fluids heavily in clinical chemistry panels. Okay. Then urine analysis. Urine analysis is done to identify uh, kidney diseases, liver diseases, and most common type of disease. What is that? Urine analysis. Urine analysis is done to identify kidney diseases, liver diseases, as well as diabetes, which has a vital importance in uh, nutrition. Or it is a nutrition related disease. It is a major non-communicable disease that is causing for huge proportion of deaths all over the world. In urine analysis, we can do urine analysis to identify kidney diseases, liver diseases, as well as diabetes. And uh, again, complete blood count is usually practiced to identify many diseases, infections, uh, and conditions. In our case, in nutritional assessment, we do complete blood count. In blood, it has a red blood cells, white blood cells, and platelets. Then the changes of these amounts uh, could represent nutritional status of individuals. Okay, then we do complete blood count as routine biochemical laboratory test. Then final thing is the stool testing. Stool testing is done to examine intestinal parasites. Okay, then this is done to identify whether our uh, whether there is whether the presence of intestinal parasites. So these are routine biochemical or laboratory test methods widely used in um, nutritional assessments. Okay, so this is the epidemiological triad of diseases or disease occurring. So to occur a disease, it involves three major uh, compartments like host, agent, and environment. We usually think that host is the microorganisms, but actually nutritional factors can also act as agents. Okay, then this is the epidemiological triad of occurring diseases. to occur a disease, any kind of disease, it involves host, agent, as well as environment. Okay, we usually think that for diseases, it it responsible only the microorganisms, but it's not. The nutrient or nutritional agents also can act as agents in uh, imposing diseases on human. As I mentioned earlier, the agent can be biological agents and most importantly nutrient agents that we particularly interested in this course. It can be protein, carbohydrate, vitamins, minerals, and water malnourishment. An excess or deficiency of the nutrient elements may result in nutritional disorders, anemia, and goitre and obesity. So nutrient agents are also responsible for occurring diseases. So usually, when we refer in the epidemiological triad, we in general we think when we are referring as agent, it is the microorganisms, but this agent can be nutrient agents also. Okay. Then these are uh, commonly used biochemical laboratory methods to uh, identify nutritional deficiencies. Okay, then for uh, protein deficiency as the primary test, we can use amino acid imbalance test and hydroxyproline test or serum albumin test. So as the secondary test, we can do serum protein fractionation by electrophoresis like techniques. Okay, then in this table you can see different uh, biochemical tests available to identify primary and secondary stages of nutritional deficiencies. Okay. If we consider the advantages of biochemical methods, uh, these methods are useful in detecting early changes in uh, metabolism, body metabolism, and nutrition before the appearance of overt clinical signs. Overt clinical signs means observable clinical signs. Okay, then uh, the clinical signs or the signs that represent a nutrition deficiencies appear after this deficiency got a significant impact on the body. Okay, then we through these biochemical methods we can identify the nutritional deficiencies before these observable clinical signs appear in our body. So it is very important. And biochemical methods are precise, accurate, and reproducible. And these biochemical methods, we can use them to identify even the mild deficiencies. So when we are using anthropometry and clinical methods, we can identify the severe deficiencies. But using biochemical methods, we can identify the mild deficiencies. So when by identifying mild deficiencies, we can prevent them. That is the importance of biochemical methods lies, and it represents the current nutritional status of the individual. Okay. Then on the other hand, biochemical methods have some disadvantages also. They are time consuming and quite expensive. It is not like anthropometric measurements. Uh, it requires well-trained personnel and sophisticated facilities. We cannot do the biochemical assessments without a sophisticated lab or well-trained personnel. So it requires capital as well as maintenance cost, then it is quite expensive. And on the other hand, it is a limitation of biochemical methods is that we have to do individual assessments as a community to measure nutritional status of a community. We have to do individual assessments, so it may consume a lot of time, and we have to do practice this for person to person. Okay, then it is a quite a limitation of biochemical methods. Okay, then these are the limitations of biochemical methods. Let's move on to the other uh, direct nutritional assessment method, which is the clinical methods. Okay, then I mentioned that there are mainly four direct nutritional assessment methods. We denote as ABCD. A is for anthropometry, B is for biochemical and laboratory methods, C is the clinical methods. Okay, then we are going to discuss about clinical methods. Um, then clinical assessment is an important practical method of assessing nutritional status in a community, and also this is an essential feature of all nutritional surveys. And clinical methods are the simplest and most practical method of evaluating the nutritional status of a group of individuals. So one limitation of biochemical methods is that it cannot be applied to a larger population. So when we assessing the nutritional status of a group of individuals or a community, this is the most feasible method. And this utilizes a number of physical signs. Okay, and the method is based on examination for changes believed to be related to inadequate nutrition that can be seen or felt in superficial epithelial tissues such as skin, eyes, mucosal membranes, hair, or organs near the surface of the body or thyroid gland. Okay, in clinical methods, we observe the individuals carefully. We do not take body fluids, urine, or blood. Okay. Well, what we do is we just observe the individual carefully with reference to some clinical signs that are known to be related to inadequate or malnutrition. Okay. Then in this part, I will explain quite a few uh, common clinical signs in malnutrition. Okay. Then clinical examination is relatively inexpensive, but many of the signs lack specificity and hence need careful examination and confirmation by other methods. It means by only observing the clinical signs, we cannot say that this man is definitely suffering from that disease or definitely suffering from that nutritional deficiency. Okay, then after that, after observing the clinical signs, we have to confirm it by through other techniques. For that we can use biochemical assessment. Okay, then in the nutritional assessment, this clinical examination or clinical assessment has a vital importance in assessing nutritional status in a group of individuals. And when we are doing the nutritional clinical assessment, we need to obtain the good nutritional history of that community, and we have to give special attention to the observable signs in hair, mouth, gums, nails, skins, eyes, tongue, and muscles. It means uh, uh, epithelial tissues. Okay. Then in a clinical assessment, we do not consider the internal organs or bodily fluids. Okay, we just observe the epithelial tissues, superficial epithelial tissues, such as skin, eyes, mucosal membrane, hair, organs near the surface of the body. Okay, then this table shows um, clinical signs that are known to be of value in a nutritional surveys or nutritional assessment and signs not related to nutrition. Okay, you have to carefully understand that some signs are not related to nutritional deficiencies at all. For an example, when we observing hair, okay, then lack of lustre, thinness, sparseness, and dyspigmentation or easily pluckability, they are considered to be related to nutrition surveys. But on the other hand, artificial discoloration or uh, artificially discolored or browned or blacked or whitened hairs are not related to nutrition deficiency or any nutrition related condition. Okay, you have to be carefully understand that. පැහැදිලි නේද? දැන් hair observe කරනකොට lack of lustre ඒ කියලා කියන්නේ දීප්තිය අඩුකම නැත්නම් මේ තුනී බව ස්පෑනස් කියලා කියන්නේ තනින් තන පිහිටීම ඊට පස්සේ මේ වර්ණය වෙනස් වීම නැත්නම් හිසක සිත්පයින් ගැලවී යාම මෙන්න මේ වගේ දේවල් නියුට්‍රිෂන් සර්වේස් වලදී වැලියු එකක් තියෙනවා ඊට අමතරව ඔයගොල්ලෝ තේරුම් ගන්න ඕන දෙයක් තමයි මේ සමහර සයින්ස් තියෙනවා ඒවා අපිට වැදගත් වෙන්නේ නැහැ නියුට්‍රිෂන් සර්වේස් වලදී නැත්නම් නියුට්‍රිෂන් රිලේටඩ් assessments වලදී නැත්නම් අපි නියුට්‍රිෂනල් ස්ටේටස් එක ඇසස් කරනකොට උදාහරණයක් විදිහට කවුරු හරි හිස කේස් කළු කරලා තියෙනවා නම් නැත්නම් දුඹුරු කරලා තියෙනවා නැත්නම් සුදු පාට කරලා තියෙනවා නම් ඒක අපිට වැදගත් වෙන සයින් එකක් නෙමෙයි. Then you have to carefully differentiate the signs not to be value in nutrition assessments and signs not related to nutrition assessments. Okay. For another example, face. In moon face, it means a fat deposited, a rounded face, and a diffuse pigmentation. It means a high melanin deposited uh, skin are non clinical signs in relation to nutrition assessment. On the other hand, acne vulgaris means pimples. So pimples or other uh, signs appear when people get adolescent. Okay, then these are not related to nutritional status. Okay, then you have to carefully differentiate the signs known to be value in nutrition assessments and signs not related to nutrition. Okay, then this table shows a number of clinical signs of nutritional importance and signs not related to nutrition assessment. Okay, then we will discuss few clinical signs of nutritional deficiency. Here you can see thin, tuny, and sparse tannin tanapihiti case. Then uh, this is this can be in relation to protein, zinc, or biotin deficiency. Okay, then easily pluckability or easily to pull out hairs may be related to protein deficiency and corkscrew coiled hair. It means අර කස්කුල්පු වගේ coil vecha hair or this kind of hair. So it can be related to vitamin C and vitamin A deficiency. This is not meant by curly hair. Okay, then it is coming from genetics or other things. Okay, then it is not related to that. Then corkscrew coiled hair. So this kind of hair and maybe in relation with vitamin A and vitamin C deficiency. Okay, then if we consider mouth, glossitis is related to glossitis means uh, inflammation in the tongue. Divya Pradahaya. And it can be in relation to deficiencies in riboflavin, niacin, folic acid, and vitamin B12, and bleeding and spongy gums, vidurumacin legalin. So it can uh, be due to vitamin C, A, K, folic, and niacin deficiencies. And angular stomatitis, and it means the damages in various stages, various places in mouth and lips. Okay, then mouth, lips, as well as tongue. So it can be due to vitamin B2, 6, and niacin deficiencies. In sore mouth and tongue, it means අපි කියන්නේ අර මුව දෙපැත්ත වනවීම. So it can be in relation to vitamin B12, 6, vitamin C, niacin, folic acid, and iron deficiency. So these are some common clinical signs that we can use in nutritional assessment when we observe in mouth. Okay. And if we go further, this eyes, exophthalmia. It means an abnormal protrusion of the eyeball or eyeballs, like this. This can be due to vitamin A deficiency and photofobial blurring, conjunctival inflammation or inflammation in the eye. This can be due to vitamin B2 and vitamin A deficiencies. Okay. Then can you think one very famous politician in Sri Lanka who is known to be suffering from exophthalmia? I don't know whether you have observed that. Mangala Samarvira, he's known to be, I think he's quite suffering from exophthalmia. This one, this sign is highly seen in this person. I'm not criticizing him or just downsizing him. I respect him a lot. I just wanted to tell you that these are this exophthalmia is a clinical sign. Okay, is that clear? Is that clear?
Yes, sir.
Okay.
Yes, sir.
Okay, then nails. In nails is spoon nails. It means this type of some lines. And a spoon, this is like a spoon. Then this may be due to iron deficiency. Also, I don't know whether you have heard that if children are eating the wooden things and the walls, then it may be a sign of iron deficiency also. Then ළමයිව සමහරලාට ඔය බිත්ති කංහූරලා කනවා නම් නැත්නම් ලී හූර හූර කනවා නම් ඒකත් මේ iron deficiency එකට කියන iron deficiency එක පෙන්වුම් කරන clinical sign එකක් කියලා කියනවා. සමහරලාට පොඩි කාලේ හැම දේවල් කරනවා නේද? පික් කරනවා ඒක ආසාවටත් කරනවා සමහරලාට ඒක ඉබේම වෙනවා. Then sometimes it might be a clinical sign of iron deficiency. And the transverse lines, it means this kind of uh, lines. And it may be due to uh, this line in this direction and the transverse lines in that direction. Okay. Then it may be due to protein deficiency. Then they are non-clinical signs of nutrient deficiency in iron and protein. Okay. Then skin. Then skin is a again a very important organ in observing nutritional deficiencies. Pale means sudumeliwima. Then pale skin shows the nutritional deficiencies of folic acid, iron, and vitamin B12. And follicular hyperkeratosis is this like condition. This means high keratin accumulation in the follicles. It means the beginning of the hair. So it may be due to vitamin B and vitamin C deficiencies. And flaking dermatitis, dermatitis is the removal of skin, such like removal of skin. Then it may be due to protein allergy, malnutrition, vitamin B12, vitamin A, zinc, and niacin. And pigmentation, this like it means a higher accumulation of melanin in the skin and being discolored. Then it may be due to niacin and protein allergy malnutrition. And brucin and purpura means that this kind of appearing this kind of signs on the skin. It may be due to vitamin K, vitamin C, and folic acid deficiencies. Okay. So, but these are good things to observe nutritional deficiencies in people, in individuals. But in order to confirm that, we need to go for a specific test. Okay. Then by observing these clinical signs, we can get an idea about the nutritional status of individuals. But in order to confirm that, we have to do biochemical and specific testing. Okay. Then uh, expansion of thyroid gland, then it may be due to goiter, and it is a reliable sign of iodine deficiency. I don't know whether you have observed that uh, when you are very young, you might have observed this kind of patients or these types people with this kind of enlarged necks a lot. But nowadays, can you see this kind of people? Can you observe this kind of people? මම දන්නේ ඔයගොල්ලෝ ඔබ්සර්ව් කරලා තියෙනවද කියලා. ඔයගොල්ලෝ පොඩි කාලේ සමහරවිට මෙන්න මේ වගේ බෙල්ල ලොකු වෙච්ච කට්ටිය ගොඩක් දැකලා ඇති. නමුත් දැන් අපිට ලංකාවේ එහෙම කට්ටිය දකින්න ලැබෙනවා. Except the beggars and the people like that. It is hard. Yes, it is hard to find this kind of people because as a result of nutritional programs. Okay, in Sri Lanka, about 2 decades ago, we introduced iron fortification program. We incorporated iodine to salt, and according to our standards, according to our regulation, it is a must. It is a regulation to include iodine for salt. So, as you know, Salt is widely consumed by all people at all levels, independent of social status, gender, and other socioeconomic factors. Or all people use salt, so it is a good intervention. So it is a good nutritional program. Okay, so we imposed a regulation that every salt manufacturer in Sri Lanka should incorporate iodine to the salt. So through that, we was able to prevent that goiter. Okay, then it is hard to find this kind of patient nowadays. Patient nowadays. Okay, then joints and bones. Then these irregularities and malformed joints and bones shows scurvy and rickets. This is due to vitamin D and vitamin C deficiencies, as well as it have influence on calcium, magnesium, and zinc deficiencies. Okay, it is this kind of rickets and scurvy is not common in Sri Lanka. Okay, so these are known and most commonly used clinical signs of nutritional deficiencies. And if we consider the advantages and limitations of clinical assessment, this assessment, fast and easy to perform, inexpensive, non-invasive. It means that we do not take bodily fluids, blood or urine from our blood, from our body. So this is easy to carry out. And on the other hand, limitation of this clinical assessment is that we are unable to detect early cases. As I mentioned earlier, we cannot detect mild deficiencies using clinical assessment. So we need to do thorough clinical assessment if we need to do if we need to identify mild deficiencies. Even though we do thorough examinations, it is not possible to identify mild deficiencies. As well as in order to confirm the nutrient deficiencies, we have to do uh, some sort of biochemical assessments also. Okay, and these are the limitations of clinical assessment. Okay, then as the last direct nutritional assessment method uh, in D, uh, we denote dietary evaluation methods. In here, we do household inquiry about pattern of food consumption, and it can be done for individual, family, or community level. There are different types of uh, dietary evaluation methods available. These are the most commonly used dietary evaluation methods. 24 hours dietary recall. In here, in 24 hours dietary recall method, a trained interviewer asks the subject or the individual to recall all food and drink taken in the previous 24 hours. And this is easy and quick, and this depend on short-term memory. So you have to recall only 24 hours of on what you have eaten and taken as drinks to your body. And since this involves an interviewer, uh, this may be not truly representative of the person's usual intake. So it is quite obvious නේ කවුරු හරි දෙකෙනෙක් ඇහුවට පස්සේ සමහරවිට අපි බොරු කියන්න ඒ කියන්නේ අපේ ස්ටේටස් එක ගැන හිතලා හරි වෙන මොකක් හරි දෙයක් ගැන හිතලා හරි සමහරවිට අපි හරියටම ඇත්ත කියන්නේ නේද අපි මේ ඊයේ රැයට මොනවද කියලා ඇහුවොත් එම තව මොකක් හරි ඇඩ් කරලා කියන්න තමයි බලන්නේ. So 24 hours data recall method is a simple and quick method, but it may be uh, not truly representative of person's usual intake due to that uh, practical difficulties. Okay, then in food frequency questionnaires, the subject or the individual is given with a list of food items. It can contain almost all the food available in that community, and he is asked to indicate, just make a tick or just make a symbol of his intake, and including the frequency and the quantity per day, per week, or per month. Okay, in food frequency questionnaires, we provide a questionnaire. Then in the questionnaire, it includes all the food varieties available in the country or that region. Okay, then he is the individual is asked to provide information about what type of food he is eaten, and what is the frequency of taken the food, and or how much did he consume the food. So these questions are there. So it's a kind of chart. So it contain list of foods and quantity that he taken and the frequency of taken. Okay, then this is a kind of dietary evaluation method. Then the dietary history since early life, or dietary history method. Um, Again, this is conducted by a trained interviewer. Details about the usual intake or the regular intake, the types, amount, frequency, and timing of the time gap between the taking the diets are taken by using a interviewer. Okay, then in here and here, 24 hours dietary recall and dietary history. These are conducted by interviewer or a person, and in food frequency questionnaire, it is given to the subject or the individual that we are concerning. Okay, then again in the food diary technique, uh, the individual is asked to um, record his food intake and the time of consumption. So this is like a diary. So we ask him to maintain a diary. Means මොනවද මම කෑවේ? ඒ කියන්නේ මම මොනවද කනවා නම් කීයටද කෑවේ? මොනවද කෑවේ? කොච්චරක් කෑවද? එන්නේ වගේ diary එකක් specific period එකක් පුරාවට maintain කරන්න කියලා. Okay. Then the length of collection of period range between 1 to 7 days. This is a reliable method if the subject is honest, but it is difficult to maintain. Okay, in food diary technique, food intake, the type and the amount is recorded by the subject at the time of consumption. Okay, in here again it does not involve interviewer. Okay, then the fifth dietary evaluation method sorry, practice is the observed food consumption. In here also, interviewer or uh, 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 person who is interviewing the dietary evaluation method is there. Okay, uh, this is the most unused of the method in clinical practice because it is uh, very hard to practice. and but is this is very reliable method on the other hand, but this has applications. I know some applications of this method in research, observed food consumption. In here, the meal eaten by the individual is weighed and contents are exactly calculated by the interviewer. Okay, the this method, as I mentioned, this method has a high degree of accuracy, but needs uh, time and effort. In here, observed food consumption means කවුරු හරි එක්කෙනෙක් එයා ළඟ ඉන්නවා අපි සලකන පුද්ගලයා ළඟ. Then before eat anything, he weigh and record the thing. But there are lots of practical difficulties. We have to be with that person, and interviewer might not be his wife or husband, so it is hard to be with him or be with the subject for all the time. But in research purposes, for uh, uh, vulnerable groups like adults or elderly people and patients, hospitalized patients, we practice this technique because in here what we can exactly tell what he ate and how much he ate and at what time he ate and other things. So using these dietary evaluation methods, we can evaluate the nutritional status of individuals. Okay, and these are the dietary evaluation methods in practice. Okay, then these are the direct nutritional assessment methods that I wanted to discuss with you. And here you can see a nice summary of nutritional assessments. And this shows the relationship between natural history of diseases and the nutritional assessment. Okay. Then, as I mentioned earlier, this is the epidemiological triad of diseases. It involves host, agent, and environment. Okay, without host, environment, and agent, there cannot be a disease. Okay, so as I explained earlier, this agent can be nutrient agents also. Most of the times we think that agent is the biological agent like diseases, disease caused bacteria, viruses, fungi, and other things. But nutrient agent also can cause diseases. Okay, then here, pre-pathogenic period is the period preliminary to the onset of disease in human. The disease's agent has not yet entered to the body, but factors which favor its interaction with the human host are already existing in the environment. Okay. Then in the pre-pathogenic period, we can identify the nutritional deficiencies through indirect assessments. Okay. As I mentioned, indirect assessment involves ecological factors and uh, some vital health statistics, such like things, and personal income and other things. Okay, so in the pre-pathogenic period, we can have an idea about the nutritional deficiencies through indirect assessments, as well as dietary evaluation methods. There can be some impact. Okay, so before onset the diseases, we can predict that if this continues, if the dietary pattern continues, this community, this particular community might have affected from this nutrition deficiency. Okay, then we can do indirect assessment uh, to identify nutrition deficiencies and malnutrition in the pre-pathogenic period. Okay, Then after the agent enters to the host, or in our importance, human, it is called a period of pathogenesis. The pathogenesis phase begins with the entry of the disease agent in the susceptible human host. Okay, then after that, we can identify the deficiency or the malnutrition through these assessments. Finally, if he died from that disease, mortality data, it is again an indirect assessment. And the morbidity data, the permanent damage, if someone suffered a permanent damage from a disease, then it is calculated for under the morbidity data. So these are again indirect assessments. Okay, then this picture, this figure shows nicely shows the relationship between the natural history of disease and the nutritional assessment. Okay, in here we can what you cannot see here is that the dietary evaluation methods. So dietary evaluation methods come in under this here. So it can identify the pre-pathogenic period, the malnutrition in this period through dietary evaluation methods. Because in that method, we exactly identify what is the subject taken, what is he regularly take as their through their diet. So we can have an idea about the nutrition deficiencies that can occur in that individual. So it's there. But then after the disease causing agent enters to the human body, as I mentioned, the agent is not necessarily the pathogens, but also nutrient agent can be there. So without exhausted and physiological and metabolic alterations can happen. So starting from that, we can do biochemical assessment. So biochemical assessment, we can identify the nutritional malnutrition or the disease from biochemical assessment after the uh, after entering the disease causing agent to the human. Okay, but after that, non-specific signs and symptoms will show, and through anthropometric assessment, we can have idea about since that stage. Okay. So initially, immediately after entering the disease-causing agent to the human, we cannot have an idea through anthropometric assessment about the uh, real cause. So after that illness or the disease occurs, okay, then after causing the disease, clinical signs will show the permanent damages. These signs are observed might be observed by permanent damages. Like as I explained earlier, it can be observed by the goitre and the malformation of bones and other things. Okay, then so after the disease occurred, the clinical assessment and morbidity data can be taken place. And finally, when the subject is died from that disease, the mortality data uh, is counted, and it is a kind of indirect assessment. Okay, then this shows uh, the relationship between natural history of disease and the nutritional assessment. Okay, then I ask you to find about or differentiate between nutritional survey and surveillance. This is your homework. Okay. Then after that, according to our post capsule, we have to discuss about uh, macronutrients, particularly proteins, carbohydrates, lipids, and dietary fiber in relation to nutrition and human health. I haven't included very tiny details here. I included the important ones. And if you are interested, please search about these things further. Okay, I think that's all. Thank you.